Hi, it's Dr. Greg Relo. I want to use this month's update to talk about something that is moving very fast right now. It's not the first time we've talked about it, but it's AI inside the dental practice. We're not in theory, we're not in the future, we're right now. And it's a very big topic because here's what we're seeing across the industry, and we're talking to a lot of players in this space. Teams are already using AI often, but it's happening in a fragmented, uncontrolled way, and that's kind of dangerous. Someone's using it to write emails, someone's using it for marketing, someone's trying it for insurance narratives or case presentation, and none of it is connected. None of it is even always known. None of it is trained on in your practice, and most of it is not secure. And that is important. That's the reality. So the risk is not should we use AI? It's that you're probably already using it in at least 70% of the offices out there just without a system. At the same time, the opportunity here is one of the biggest I've seen in nearly 30 years. So when this is implemented correctly, it really does touch everything. How your team communicates with patients, how cases are presented and accepted, how insurance narratives are written, how consistently clinical decisions are supported, how efficiently your front office operates. This is not a small tool. This is operational leverage, a scale we have not seen before, and it directly impacts profit. So better communication increases case acceptance. Better clarity improves production per visit. Better systems improve collections and reduce friction. And this is how practices quietly separate right now. And here's the really vital part. We already have some of this built. It's not a generic AI tool. It's a structured system designed specifically for dental practices. It can be implemented across your workflows, your team, and your communication. And more importantly, we know how to implement it correctly because this is where most practices will struggle. Implementation, execution. It's not access to AI that creates value. It's how it's integrated into the day-to-day of your practice. That's the difference. So over the next few weeks, we're going to start rolling this into your environment in a very practical way. If you're interested, it's not overwhelming, it's not theoretical, and it's not expensive. It's focused on real use cases your team will actually put into place. So my recommendation is simple. Lean into this early because the practices that implement this correctly now are going to operate at a different level within the next 6 to 12 months. We're already seeing it. And if you want to get ahead of that curve, let's talk. We'll map out exactly how this foundation fits into your practice. Again, these are not big, expensive tools. We call it AI foundations. Love to talk to you about it. Talk soon.